Thank you very much. Thank you, Dr. Thiel and Ms. van der Poel, for inviting me. And I'm very happy to be able to talk on this important topic of siblings. One thing I wanted to ask, I did bring along some handouts in German. I don't know if I didn't know how many German parents there would be, but here's handouts in German. I would like to ask if there is any siblings here. Okay, yeah, I've seen them. They are colored really brightly in the face, right? But you're okay. Thank you. Thank you. That's good. I used to work for many years in pediatric clinics, for example, in the University Clinic of Bonn, and I also worked here in Cologne in the pediatric clinic called Amsterdamer Straße. So it's kind of like coming home, going back to Cologne. Today I would like, hopefully, to be able to answer the question why siblings are an important issue, and then hopefully I can give you some ideas and some things that you might be able to do with your as parents and as a family. So let's start with a few case studies. I did bring along Samira, the sister of Kevin, and she said that before Kevin's first seizure, they had a terrible argument, and that she was really mean to him. And she was assuming that he only had the seizure because of her being angry to him. And then recently, even the ambulance came at night and did take her brother to the hospital, so she was even more afraid and worried. So that is probably something typical. And then let me introduce this lovely young woman, Lailani. She just turned 21 last week. She also has a very rare genetic disease, which is called cri du chat, or cat's cry syndrome. Her mother is apparently a good friend of mine, and so I've known her since birth, and just saw her a few weeks ago. And she also has a younger brother. She also has two older sisters, and they did write a book together, which is kind of nice because it's both in English and German. So if you want to have a look at that, you can hand it out. Oh, sorry, that's okay. They describe the perspectives of how it feels to be the brother of a younger, but of an older, but apparently younger sister, kind of. And then there's Hannah. I took her example from the internet page Siblings Network, a German page, and she is the sister of Kyra, and she tries to be perfect, tries to help a lot, and she has lots of fun with her sister, but sometimes it's also annoying because most of the time her mom goes to appointments and then she can do those things like going shopping with mom or to the movies only with dad, which is okay, but sometimes I think she'd probably like to go there with mom too. And she's joining one of those siblings groups. I didn't translate that, that's from the page, and she really enjoys that, but I'll come back to that later. So as you probably have recognized your daughter, son, brother, sister, or who else in those case studies, and you all know that it's important to keep an eye on the healthy siblings. I will just give you some risk factors that might happen if you won't, and just let me real quick point out 2, 3. We saw feelings of guilt in the case studies, or what often happens is fewer social context. Those things are interesting. I hope that works on the wall. So there's a lot of risk factors for siblings, and you probably heard the saying that they are called shadow children, because sometimes the disease and all that shadows the healthy sibling. And just a few quick facts. In Germany, there's 1.24 million kids who have a chronic diseased ill brother or sister, and it is normal that parents focus heavily on the sick child, and that the siblings can get along with that very well. But and most of them manage that quite well, but sometimes there's also problems with that. And research shows on one hand that they have a risk to develop all kinds of behavioral problems, but on the other hand, they also can grow up and develop into very empathetic, self-confident individuals. And now you probably ask yourself how you can put the scale more to this side and strengthen your healthy kids. And I would like to give you some strategies on the hand. And don't worry, they are all very simple and easy to implement. So let's have a look at that. Most of them are small things with very huge impact. So first of all, it's very simple, but talk to each other. That sounds almost trivial, but if you read surveys of siblings, that's exactly what they say. They want you to listen to them and make them feel that you notice and understand them. So speak, listen, be present, and you can do that on a regular basis, like during meals, or you can also install like a weekly kind of family council or something like that. Many siblings ask themselves many things, and they ask themselves whether they can also contract the disease, or whether they are to blame for the disease, or if they did something wrong, or the parents are mad or angry at them, or they are a burden. Or sometimes they even ask themselves, when the brother or sister is not feeling well, whether they would die. And so that is also very important, that you talk to the healthy siblings about the disease. So that's also what surveys show, that siblings want to know, and they want to be spoken to openly and honestly. They want to know what's going on with their brother or sister. And that doesn't mean that you have to say everything in detail, but please don't make it a terrible secret. And as you all know, all of your kids have those little antennas, which you can't see, but they are certainly there. And everything that you're trying to hide from them, they know exactly. And that is also true about the disease. So please do that, talk about the disease. And that should be as early, as honestly, as thoroughly as necessary. And I can tell you at that point, being a professional on that side, that will alleviate a lot of stress and fears of your healthy kids. And you don't have to speak doctor's language, just my colleague just said, but you can also use, like, make up your own words or a family language kind of thing. And you don't have to make it a constant topic either, but please do address that. And another point that is very important too, talk to the people that surround your kids, like teachers or educators or trainers from sport and stuff, because they don't understand what's going on with your child. And that makes it much more easy. If you have young kids, this is also taken from that book. You can sometimes use kids' books that explain genetic diseases and things, just to make it easier. And another thing that I find very important, you are a very important role model, and try to keep an eye on what and how you say things. It does sound completely different if you say, we can do this together, even if it is difficult, rather than saying, oh, we have such a difficult fate because of your brother's disease. And try to be positive. But that doesn't mean that you have to be positive all the time. Sometimes you're mad, you're sad, whatever, and that is normal, and you shouldn't hide that either. And kids understand things, and you just have to explain them to them. So please do that. And oh, das ist die falsche Richtung. The last sentence I wanted to address too, if it's difficult for you to do that, then please don't hesitate and seek for help, because there's lots of people that can help you. And please don't use kids as substitute parents. Keep on checking on your expectations for your child, and don't put such a very heavy burden on your child of, for example, saying, oh, you have to take care of your brother or sister maybe after I'm dead. So that is such a heavy burden that shouldn't be put on a child. In my practice, I often use those big rocks, and we try to find out what all is a burden for the kid. And they use different sized rocks, and then they put them in a backpack or some other container, and then they carry them around, and pretty soon they find out, oh, that is too heavy. And that gives a good basis for us to find out whether maybe we can reduce some of the stones, maybe exchange a bigger one for a smaller one, or whatever we could do there. And you all know those silly sayings, and the kids, the healthy ones, they hear those also. And that has to be addressed too, because stupid comments, teasing, bullying does have a big effect on the self-esteem or other issues. And so that would be important too, to talk about these things. And at the same point, when you believe, oh, I can't do that all myself, we can't resolve this, then please don't hesitate and consult the teachers, educators, or other specialists. Kids often feel different. That is happening all the time. And that has all kinds of different reasons. And kids of ill brothers or sisters often feel different too. And there's lots of material. This is all in German, but I'm pretty sure there's all kinds of books in Netherlands or in English or all kinds of different languages. So use those, or maybe use some other materials. I did bring along a few things that we published. This is the superhero creating kind of tool or game. Somebody asked me whether I have ideas on what you can use without language. That would be an example. And we tried to put all kinds of stuff like those protheses and stuff in there. There's another point that addresses also siblings, and that is strong feelings. I put this roller coaster on this slide because sometimes it feels like a roller coaster, because there's like all kinds of like moments where you are very frightened or really mad or sad, or all kinds of feelings that happen, and those I want you to encourage also to address these. And there's just a few ideas. This lovely lady, I don't know your name, you just mentioned using a scale. I do that all the time because I'm not a doctor, so I don't take blood examples or things like that. And we often craft feeling meters or just draw the numbers from 1 to 10. And then we can find out how strong is the feeling at the moment. And to deal with strong emotions, there's a lot of things that you can do, and that would be good beforehand when the feeling is not a 10, to find out what would help when it's on a different level. And just to give you a quick idea, when a feeling is really strong, like a 10 of anger or something like that, then it won't help to, I don't know, do something very low level. Then you need to do you have to have like a strong thing to do to react. And that could, most of the times, those things are things that have to do with our sensory organs, like a very strong smell, or a really sour taste, or doing exercise, or throwing things at each other. There's quite a few ideas in this box, which is also a gift for your psychological unit here. This is in German, but the pictures also work. Another point which siblings also address, they have their own needs and they want to have space. So please let them have fun, enjoy themselves, do things with their friends, and just have also a lot of normal time. One thing I really think is a good idea to do is to do activities with just one child. That doesn't mean that you have to have like a whole day, I don't know, do something extraordinary. Most of the time it's little things, but very exclusive time, where it's clear that nobody can just interrupt you, or that it's just normal that you two do something together. And you can also, whoops, das ist echt. You can also talk to both of, or how many ever kids you have, but you can talk to the healthy and the sick child about that, and they will understand. Then another point, there's quite a few who came with an airplane here. And in the airplane, they always tell you to put on your own mask first, and then help others. And that is something very important. You have to think about yourself as parents, because only if you do that, you can help your family. So please do that and try to go to sports, meet with friends, or do whatever is helpful for yourself. And same is important if you have a partner. Please do that with your partner too. Take time together and maybe go on a date, even after so many years, and make it a challenge, and don't talk about the disease during you are on a lunch or whatever you do together. And there's another idea that's very simple. Use one of those praise in the box tools, how we called it. It's simple. You just have little pieces of paper where you write down things that your kids have done that were cool, great, whatever, and then you put them in the box, and then you sit together maybe once a week and read out what was on those papers. And involve the whole family. Sometimes you have maybe a motivational reinforcement plan, and then involve everyone. I don't know, maybe the sick child gets a smiley when they take their medicine or something like that, and they do that well. And maybe the healthy child gets smileys for bringing out the garbage or whatever. And mom maybe gets a smiley for going on a date with her friend or things like that, and dad for going out for sports or whatever that is. And then you collect together, and when you have a certain amount of points, then on the weekend, for example, you do something nice together as a family. So then you collect all together, and then maybe the child says, "Oh, mom, you haven't gone to sport yet. You need to do that because we want your smiley." And another idea, we did do this game, designed this game during Corona. I did bring some copies in German and some in English. So if you want, you can grab one of those. It's a very simple game, but it's a lot of fun. You can also download it from my internet page. And coming to the end, I want to talk about networking. There's a huge and very impressive network right here, and I think that is so cool. Like, I can't really pronounce your name. Can you? No, your name, your last name. I'm so sorry. Okay, so Eva, I think it is so great that you installed all this and had this good idea. And I know, but you're the one that I know now. So I mean everyone else, of course, too. But sometimes it makes sense to look at who is in your network and write it down and find out who is helpful and who not, and try to spend time with those that help you or that have a positive attitude on you. And use self-help groups. I'm a big fan of that. And maybe this is a picture of a siblings group from Germany, but I'm pretty sure that those exist also in other countries. I didn't research on that, but I'm pretty sure you have those. And if you don't, then maybe you open up one of those groups. And if you don't get along with all these things by yourself, then please don't hesitate and take professional help. There's lots of very good people that could help you. And as a conclusion, for the parents and caregivers, think about yourself and then about all family members. And that is because only together you're strong. And for doctors, medical treatment staff, please be aware of possible stress on siblings and ask about that. And sometimes a joint consultation with the patient and siblings can be a very helpful thing. So I would like to thank you for your attention.